time. I wanted to just give it a little bit of time, but let me just confirm first and foremost if, yes, we have both doctors with us. Dr. Mariam, I think you can unmute and confirm to me if you're good so that we confirm your sound and everything.
Yes, Fatma. Assalamu alaikum.
Alaikum salam. Good evening. How are you?
Thank you. I'm fine, thank you.
Okay, your sound is good. I'm very good. Your sound is good and clear and perfect. So thank you. I wanted to confirm that before we start.
Sawa.
Okay, sawa. Okay. Thank you. And also, I think Mogaka Alfred, that is you, Dr. Please, yes. Hi, Dr. How are you doing?
I'm okay. I'm all right. Thank you.
Okay, thank you so much. I know people will keep joining in as we continue, but I wanted for us to also be time conscious because I know everyone has had a very long day, busy day, but we just wanted to make sure that we just kickstart and then everyone else as they join, they can be able to ask questions along the way. Is that okay with you, Daktari?
That's fine.
Okay, sawa. So before we begin, I just wanted to welcome everyone who has joined us. I wanted for you guys to just have a chance to have this particular session so that you can learn more about reproductive health. And also today's topic is on fibroids. And we picked the topic fibroids simply because we're seeing that there are so many women every other day being diagnosed with fibroids. And this is a conversation that we have to have because as women keep getting diagnosed, it means that there are more women who need information in terms of guidance, whether it's treatment options, whether it's their lifestyle, and also their mental health. Because as we are going to find out later, your hormones do play a part when it comes to your mental health. So before I go too far, allow me to first of all just introduce myself and then I will introduce our guests today. So I'm Fatma and the founder of Wellnesske, and this is a platform that I founded after I had fibroids for very many years, about 10, 15 years. And unfortunately, after having fibroids, I ended up having a blood clot, deep vein thrombosis. And it was due to high estrogen levels that I ended up in this situation. But unfortunately, I did not have the right information. And so because I did not have the right information, I did not feel like I had the right guidance for me to switch my lifestyle and to be better. But I'm grateful along the way after starting this platform, I've managed to meet different women. I've also managed to meet great doctors like the doctors you're going to listen to today because they are very interested in your health, in making sure that you are well. So Wellnesske as a platform makes sure that you have the right information and also solutions so that you can be able to improve your reproductive health. And we continue to have conversations around this particular issue on reproductive health because this topic should not be stigmatized. Anything related to women's health should not be stigmatized. So that's why we have platforms like this. So today we have Dr. Alfred Mokomba, gynecologist and obstetrician from Kenyatta National Hospital. He will be leading the conversation regarding fibroids, and also today specifically we wanted for women to learn treatment options that are not necessarily surgical treatment options, but for them to learn other ways that they can find treatment if they have a fibroids diagnosis. And we also have Dr. Mariam Musa, a psychologist from Duara Psychology, and also who has had many years as a community health worker and very, very focused on community health. And she's here also to guide us regarding the conversation on mental health, because as you will find out, a fibroids diagnosis is a diagnosis that is related to hormones, and your hormones always affect your mental health. And I'm sure there are women who are nodding their heads because after such a diagnosis, you probably have a lot of anxiety over whether you will have children or not. You have anxiety over whether you are enough as a woman or something is wrong with you. So the mental health support is very important. So that I don't take too much time, let me start off with Dr. Mukomba so that he can be able to start the conversation. Daktari, I just wanted for you to give the women who are here just a brief understanding of fibroids so that now we can start talking about the treatment options. Daktari, over to you.
Thank you, Fatma. Uterine fibroids are most times non-cancerous growths that occur within the muscles of the uterus. So they'll start as very small, small nodules, very small size, and with time, as one ages, they keep growing, and they can grow to a point where they cause a number of health problems. By and large, what causes fibroids is the biggest contributor is genetics. Like for us, Africans are more predisposed to develop these uterine fibroids than are the other races. The amount of estrogen is an hormone that is in large amounts, especially in women. But if it's in excessive amounts, then it can stimulate the growth of fibroids, and this especially occurs in women who have problems with weight, who are a bit overweight or obesity, because they're able to make a lot of estrogen that stimulates the growth of these fibroids. They're also common in women, the women who reach their late 30s and early 40s before giving birth. We do note they have a slightly higher risk of developing fibroids. Like I said, most times they are non-cancerous, but we do see about 2% of women with fibroids will have them developing into cancerous types, which are extremely dangerous. It is also important to note that most of the women with smaller fibroids will have no signs, no symptoms. It will cause them no problems, and they're able to go about their lives without any issue. They only cause a problem when they are very big, or depending on where in the uterus they are. If they are within the uterine cavity, inside the uterus, they tend to cause a lot of bleeding during the monthly periods. A lady will notice that she bleeds a lot than before, and for a prolonged period of time, the number of days increase. Also, if they are within the muscle itself, if they become large, they can also cause bleeding. There are also those who have the fibroids. They grow on top, just on the top layer of the uterus. Those ones don't tend to cause problems, but they can grow and become very large and then cause pressure symptoms to the surrounding organs, like constipation. If they press on the blood vessels, then you have clots developing in the legs, and that is extremely dangerous because it can go to the chest and cause a lot of trouble. It can make somebody to urinate more frequently if it's pressing on the urinary bladder. Some women do experience constipation, and they don't have the appetite to eat. They're unable to go for a long call for a long time if it's pressing on the intestines. Fibroids per se do not cause infertility unless it's only when they are very big and blocking the fallopian tubes. That's when infertility comes in. Or if they grow into the uterine cavity, so the baby has nowhere to the baby has nowhere to implant during the early stages of pregnancy, and that can lead to some element of infertility, or if a woman becomes pregnant, there is a risk of miscarriage. Women do get pregnant with fibroids. The only problem is because during pregnancy the hormone levels are so high, the fibroids also grow almost as fast as the baby, and can grow to a very big size. And the problem they do cause is a lot of pain, because at some point they have to grow the nutrition from the blood vessels, and then they start breaking down, and that causes a lot of pain. So majority of women, I would say about 60-65%, do not need any intervention on their fibroids. If they are very small, they are not causing bleeding, they are not big to cause a swollen abdomen, they are not causing the other problems I highlighted, we do not actually need to do anything. But we know as one grows, they keep growing, maybe up to around after age 50, as menopause sets in, then they start shrinking. So we are a bit cautious. If you get an elderly lady above 50 who has fibroids that are growing, those are the ones that are risky and can easily turn into cancerous types.
Okay.
Yeah.
Okay. Sorry.
I can leave it there then, so that we can have a discussion.
Yes, thank you so much. I actually wanted to ask you some questions because people had sent in some of their questions, and some women also feel uncomfortable to ask some of these questions direct. But you mentioned that Africans are more predisposed to having fibroids. I just wanted to ask you if you know why this is so. Is it anything to do with the lifestyle? Is it anything to do with genetics? And why is it that it is mostly African women who also have worse symptoms as compared to their counterparts? Do you have an answer to that?
Mostly it's the genetic. There are some genetic things that happen, and that is a natural process that predisposes us Africans. There are several conditions that are predetermined by one's genetics. For example, the Jews, the Jews are more predisposed to develop ovarian cancer than other people in the world, and it's just a question of genetics, how they were created. Mostly. That's why. And then in Africa, I think partly because of our diet or something, the fibroids can grow huge, and also our health facilities are not that well developed, so people will go to hospital when those fibroids are huge. They are bled for many years, and they are really at their end is when they reach where they can get help. That's why we get them very usual. With the Wazungus, they have annual screening. So you go, you have your scan, and even tiny ones can be picked up, and it's easy to follow up. But for us, we hardly have any screening for most of our conditions. So the ones we do see are the ones with big ones that are causing problems.
Okay, so in this particular situation, because you've mentioned it is more about genetics, right? So how does an African woman ensure that they don't end up a statistic? Because it's almost like telling someone that you're bound to just have these fibroids. How can a woman really get to a position where they just don't end up as statistics, since 1 in 2 women actually have fibroids?
Yeah, what we need to do is, fortunately, the fibroids are not cancerous in most of the cases, and most people will have them anyway. So in terms of prevention, those who are bound to have them will have them. If your mother had fibroids, the daughters are likely to have them. The most important thing is to watch out for the signs. If the abdomen is getting swollen gradually over time, and that should cause worry, one should get checked. If the periods are heavy, one was using 2-3 pads per day, and now they're using 6, they're using 8-10, that is an alarm. It should be checked.
Okay.
if one is getting constipation frequently, if one is having to pass urine more frequently and it's not an infection, then they should be checked. But like I said, most will have and they will cause no problems. But if one experiences any of these signs,
Yeah.
always I think is to have it checked.
Okay. And there's another question I have here. You mentioned the fact that fibroids don't necessarily cause infertility. And
Yes.
when women have fibroids, that is usually their biggest worry. Their issue is their fertility. And I say this because every single day I talk to around 5 women in a day who have a fear of the, fibroids maybe interrupting their fertility, or causing them to, have issues with their fertility. So my question is, you've mentioned that sometimes some fibroids actually block the fallopian tubes. And so it's more of a mechanical issue as opposed to the
Yes.
fibroid itself doing something to make a woman infertile, right?
Precisely.
Okay, so then that means that when a woman knows the position of the fibroids, then they stand a higher chance to know whether they can have children or not, or if they carry a pregnancy, they can carry it to full term. Am I right? And maybe you can be able to
That's correct.
expound.
Yeah, fibroids, like I said, per se, do not cause infertility. There are many women with fibroids and they have conceived, they have carried the pregnancies, and have children. It's only, like you explained very clearly, if there is a mechanical blockage of the tubes, or sometimes if the fibroids are growing inside the uterine cavity, so it blocks implantation or it blocks the tubes, but that's not as common. So people should not be scared as such. Even if one has some small fibroids, those actually are not the cause of the infertility. We should be able to investigate more whether there are other causes of infertility in case one has that particular challenge. On top of screening for fibroids, the most important screening a woman should do anytime, whether you have fibroids or not, is a Pap Smear for cervical cancer screening. It's unrelated, but it's important to highlight it here because we are seeing more and more women coming down with very advanced cervical cancer, which we can prevent. We can pick early signs before it becomes cancer through these Pap Smear screenings.
Okay.
Or even if it's cancer, we can pick it very early before one starts having a problem. So that's by the way, now that we mentioned about looking out for fibroids, very, very important.
Okay, and when you talk about this Pap smear, you want for women to do a Pap smear. How many times should they get a Pap smear? And at the same time, what is the procedure? Because I'm sure there are women right now who are listening and they'd like to do it, but how can they do it? Maybe you can explain to us.
Yeah, we recommend it's done once every year for 3 years. If it's normal, then one can do it every 3 years after that. That's the Pap smear in terms of the duration. So once every year for 3 years. If it's normal, then we space it to 3 years.
Okay.
Normally it's done, the Pap smear itself is through a vaginal examination using what we call a speculum, so that we're able to access that part we call the cervix. Then we pass a soft brush which takes the cells, and we screen if these cells have any changes that can put somebody at risk of cancer if nothing is done. Yes,
Okay.
but there is also one that we are encouraging now, but it's not readily available, slightly expensive, called HPV screening.
Yes.
HPV is a virus, human papilloma virus, that is responsible for causing cervical cancer. And there are self kits. You are given a kit with a brush, then at home you just push it gently into the vagina and you turn it round and it picks the cells. You put it back in the container and take it to the laboratory. That's a self-test, but it's a little expensive and not readily available. That would be the best because people won't be shy of going to the hospital to be
To do it.
screened. Yeah, so it's very important. And for the younger ladies, there is a vaccine which we are
Mm.
giving for children from 10 years onwards, girls, before they are sexually active, to prevent them from these HPV virus infections. Yes,
Oh,
that's a by the way. So we can go back to the fibroids.
no problem, Doctor. Actually, that was a very important topic, and I'm sure you know that
Yes,
today is National Human Papillomavirus Day, International Human Papillomavirus Day. So it's a very important thing that you've mentioned, because I
yeah,
feel like because it is something someone can do it at home, then
yeah.
women here can actually know that this is an option. And even when you mentioned the fact that it is expensive, I always like to tell women that whenever you think about your health, think about your livelihood. So even if it
Yeah.
is expensive, think about what it could prevent, and
It's
that's
about
going to make
it's about
more.
6,000 Kenya shillings.
Okay, sawa. So it's about 6,000 Kenya shillings. And where can they buy this kit? How does one actually get the kit?
Yeah, Lancet Laboratories, they do have, I think there are branches in the major towns, but the other screenings are available up to health center level throughout
Okay.
the country. Yes.
Okay, thank you so much for that. You've actually shared really good information, and I'm sure women have managed to learn a lot. And I think the last part that I really wanted to ask you was about the fact that you said when a woman has fibroids and they are small and they are not causing any problems, normally you advise to leave them unattended. We I had the pleasure of being on NTV Health Diary, and that's where we managed to meet. And I shared my story, and I shared the fact that when I was diagnosed, I had a small fibroid and it was pea-sized, and the doctor told me, you don't need to do anything. It's not causing any problems. And unfortunately, after a while, I ended up having 5 fibroids, then 7 fibroids.
Yeah.
Then during when I had my surgery, I had 23 fibroids removed. So there is a woman out there who has probably been advised to leave the fibroids unattended. But most of them are asking, now, how come when we leave them unattended and they have no symptoms, they lead to symptoms and they grow? In between, what can somebody do so that they can ensure they don't end up in that particular situation? Maybe you can advise us.
Yeah. We say this because many women have these fibroids. If there's what we know, if they are small, as you age, as the years increase, they'll also grow. So they need to be monitored. By not doing much about it, we mean we should not rush to operate or give hormonal medication,
Yes.
but we should be able to monitor so
Okay.
that annually we do an ultrasound scan and see this lady had fibroids. Where are we? Have they increased in size? Are they causing problems? So that then we are able to act early if they show any signs of causing trouble. Yes.
Okay,
So
sawa
that's what
sawa.
we mean. So one should not neglect themselves
Mm.
or be neglected if they have fibroids. They should be monitored if they are not causing trouble. And those are the ones if they are not too big, if they are not causing bleeding, one can observe, but have the monitoring like I have said.
Okay, sawa. So, Dr. You've actually shared a lot of information, and I'm seeing the questions are streaming in. But what I wanted to do, I wanted for us to, because there was a topic you mentioned, and I wanted to now invite Dr. Mariam so that she can also answer a couple of questions, because there is a conversation here that Dr. has mentioned about the fact that fibroids does not affect a woman's fertility. But I want to bring it to now mental health when it comes to women and fibroids. Whenever this diagnosis is made, there's a lot of anxiety, and women really do go into depression. As someone who has had this condition for many years, I can say that I have gone through depression for sure, and also fear, because you are not sure what's really going to happen to you. The society already has its own stigma about what they think about women who have these types of issues, and also culturally, We also have people who tell you so many things that are not true. But now I'd like to really just invite Dr. Mariam so that you can guide us. When a woman has had a fibroids diagnosis, what is the first step she can take just so that she can be able to take care of her mental health? And throughout that journey, how can she ensure that she takes care of her mental health?
Okay, thank you, Fatma. First of all, I want to thank Dr. Mugaka, for that very good, insightful message. And I'm sure many people have benefited from that information. It's really, you've given us the facts about fibroids, and that's very enlightening. Maybe just to mention that this is one of the topics that I think is not discussed. And even I feel like people don't even see the need to discuss fibroids somehow because they believe that they do not affect anybody's health. So, but as we move on, it's important to note that many people are affected by fibroids, despite the fact that they are benign. First of all, not many people understand that they are benign, and there is always that fear of whether it is cancerous or something of the sort. So fibroids and mental health, definitely any condition, any health condition has the mental side to it, because we know that whatever affects one part of our system affects the other systems in the body. So when we have a condition in this is the reproductive system, most definitely it's connected to other systems like the nervous system, the limbic system, and then the rest of the systems in our bodies. So for this case, the hormones are related to stress. And for example, you find that somebody who has fibroids, because of the tendency to be worried more, thinking more about their situation and what they can do about it, and especially with the lack of information on what to do, and plus the stigma, plus the myths and misconceptions that we have around us, you find that this really bear on somebody's mental health. And with this, let's say, for example, a young lady, and for sure, as somebody who is into psychology, I have met people who are, let me say, who were left or ditched by their supposed fiancés or boyfriends because they had fibroids. And this, it might not be that the partner leaving them had bad intentions, but the thing is, this partner was worried that this girl or lady might not be able to give birth. So because of the myths and the misconceptions surrounding fibroids, then you find that this has already affected somebody's life. So because somebody has fibroids and they might constantly are thinking, and this then means that it affects their stress levels. So because then somebody is more stressed, then you find that the brain will send signals for more hormones to be released to the ovaries, in the ovaries, so that you find that the more hormones come, and this also affect the amount of levels in the body. And you find that the Clary said very well, we have estrogen. So then the stress hormone now, also the cortisol, if we have it in the system because somebody is more worried all the time, is thinking, and these negative thoughts surrounding this person might contribute to this person also, the fibroids growing even bigger. So you find that it is something that is a vicious cycle. Because of the stress, then it might affect even the rate at which the fibroids grow. They might grow faster, they might become bigger because the person is worried and the hormone levels are increasing. So that is where there is the relation. At the same time, you find that some of the researchers conducted found that most people with fibroids have anxiety and depression. And because of this, of course, it affects the person's overall quality of life. So, and this, we find that when somebody has been affected in this way, it continues to a level where it might also affect the social life of this person and that all that. So you find that it is related to. And also the fact that a person is, maybe they have developed and they're at a stage where the fibroids have started bringing complications. Yeah? So then they affect the person. Let's take the example where somebody has this, like the Terry said, frequent urination, heavy bleeding. So at night, the person will not sleep well. So meaning that when they get up in the morning, they are fatigued, they're feeling overtired, they are moody and all that. So you find that it still will affect the person's way of relating even with others. And it can even affect the person, the productivity. If this person is employed somewhere, you find it. And another thing that is on the physical side is the person with fibroids, if they have overgrown, maybe the person gets into a vehicle and people are standing for her to sit. Mama Keti hapa, because they think that the lady is pregnant. And here is this lady who is worried about her fertility, that she might not be able to give birth. And then here is the reality that people think she's pregnant and they're expecting, some are even asking, Nilini, when is the date? Yeah. And if this is a lady, maybe in our African society, maybe somebody who is married and they have not given birth yet, and you find that now there's even, let's say, the family-in-law will also start questioning. And then it becomes something that affects the overall health and overall well-being of the person and even the partner. So that being what it is, it's very true that fibroids will affect the person's mental health directly and indirectly. So what is a person to do? Because it has to do with health, and mental health is part of health in general. So then, first of all, let me also mention that there are symptoms like bloating and swelling, and this also can affect the woman's body image. Yeah. So you find that even like now, there are more and more younger women developing fibroids. I've seen girls even at the age of 20 or even less developing fibroids and having to undergo surgery. So you find that the symptoms like swelling and bloating can also cause anxiety, so low self-esteem, and affect the person's body image, which all this combined will overall start, of course, affecting this person psychologically in different ways. So the excessive bleeding, which also may make this person's life difficult, and the symptoms that are associated with it, including even because of the low iron and the person becoming anemic. So you can imagine all these are related. And of course, it comes with fatigue because of the heavy bleeding and all that. So when a person is fatigued, they might not be able to do the normal things that they do, which will still affect the way they think also, and affect even their overall relationships. So then important also to note is that because of this, the mood swings, which can affect a person's overall health, and the energy levels being very low, some factors need to be put in place. One, the person needs to, first of all, to seek help. It's very important to seek help from qualified personnel, like seeing the doctor. Like the doctor said, aptly, the person needs to have follow-up, not just to neglect themselves or to be neglected. So follow-up with the doctor, a qualified person. They need also to take care of their mental health by having interactions with positive interactions with people who can add value. At the same time, they can seek help from qualified, let's say, a counselor or somebody who can guide them professionally, and seek help in other ways if it is work and all that, to explain themselves to somebody who can be understanding. And of course, to be physically active so that to increase the system to be active by somebody having to exercise, to work out and to be active, and to maintain normal interaction so that the person doesn't isolate themselves, so that it becomes even worse and it leads to depression. So social networking is very important because it adds value when it is positive. Maybe for now, I can stop there. We proceed first. Yeah, so even if we have questions, we can answer them too. Thank you for now.
Thank you. I don't know if something is wrong with my sound. Now it's okay. Okay, Sawa. I just wanted to say that there's an important point you've mentioned there about social interaction. It's very important. And for any woman who is going through any kind of diagnosis, diagnosis that is related to her reproductive health, it's important to also have support groups. So seeing that there are women who have had fibroids, women who have fibroids, or women who are healing from maybe treatment, is actually going to help you in your journey. You will learn from other women. So the support part is really, really important. And I can say that for me, I wish I had that before, because if I did, then I would know things to avoid, things to do, because it is so much that you're trying to do as you're handling this body of yours so that you can be better and you can be well. So that is information that I feel every woman should have, and they need to constantly just seek that. And we at Wellnesske, we like to offer that support group for women. Anything that they're going through, we try as hard as we can to make sure that they understand this is just a diagnosis, but then, it's a step-by-step process of you also changing your life, eating healthy, starting your exercise regimen, also going for checkups, checking your hormone levels, and so forth. So thank you so much, Daktari. I know we are trying to, switch from reproductive health to mental health, but I have to commend both of you, because you're giving us such valuable information in this, amount of time. And even just what you've given us is really, really beneficial. And I see that we do have questions, but I wanted to now welcome Dr. Mukomba as well, so that talk to us about fibroids treatment. So Daktari, for today, majority of the women, because we carried out a survey and asked women what they would really want to learn about fibroids, and almost every one of them wanted to know about treatment options that are not necessarily surgical options, right? So you find that when women have fibroids, their biggest worry, sorry, I think something is wrong with my sound. Yes, and so their biggest worry is surgery, and they're not mentally prepared for that. So I just wanted to ask you, for you to walk us through some of the non-surgical options, treatment options for fibroids, and then you can slowly tell us what to expect from these treatment options. Are there any side effects? Should women know about them? And, just at least that way, they can be able to make informed decisions. Over to you.
Okay, thank you for that. Yeah. So in terms of treatment of fibroids, there are many options, non-surgical and surgical options. For the non-surgical options, like I mentioned, if the fibroids are too small and not causing trouble, there is the option of follow-up. Just follow up to monitor so that they don't grow and cause problems. But in addition to that follow-up, it's exercise, because as you exercise, you burn the excess fat in the body. Excess fat is what where estrogen is made from in the body. So if one avoids anything that will lead to being overweight or obese, they reduce these chances. Of course, less of meat products, because most of them tend eventually to be converted into estrogen, because we know they contribute to obesity. And foods that contribute to obesity, a lot of carbohydrates, of course, on top of causing problems, in causing other conditions, even this one, it can make it beneficial. The second active options now, where the fibroids are causing trouble and the lady does not want surgery, or really the alternatives other than surgery that one can take, because all of us, if we were offered options other than surgery, we will take it. There is an injection that we do give. It blocks the production of estrogen in the body, especially if somebody has very big fibroids and they do not wish to go through surgery. This one is given every 3 months, but we can only give it for a short time, because what it does in blocking the production of estrogen, it induces a kind of artificial menopause. So one can get hot flashes where one gets a lot of the temperature rises. It's like one gets a fever and starts sweating, and that can cause that kind of discomfort. And also during that time, if used for long, it can interfere with the fertility, because it suppresses the ovaries as well. So that is an injection. There's a drug called Zoladex or Alfred. These ones block the production of estrogen, and they can buy time to slow down the growth of these fibroids. One can also use progesterone-based hormonal preparations. These ones have also been shown to block the growth of fibroids, because the main stimulator for fibroids to grow is a hormone called estrogen. Apart from, so we've said the injection, the tablets containing estrogen, progesterone, sorry, and the other intervention that can be done, which is also coming into play, although it's expensive and works very well, is what we call uterine artery embolization. This is unfortunately only available in the high-end hospitals, mostly in Nairobi. This is where some medicine is injected into the blood vessels that supply the uterus, and you block those vessels, so you starve the fibroids and they stop growing. But like I said, it's expensive. Available in the bigger hospitals like Kenyatta and Aga Khan University Hospital in Nairobi. Yeah, it can be quite costly. So this one, since you have starved the fibroids, it's a long-term way of stopping the fibroids from growing. Yeah, those are the most of the non-surgical options one can take. So I repeat, things to do with exercise, diet, avoid a lot of carbohydrates, minimize meat products, avoid diet that can lead to obesity, then injection with the anti-estrogen drugs to block estrogen in the body so that the fibroids can shrink, and then finally the uterine artery embolization, where chemicals are injected into the blood supply, the blood vessels that supply the uterus, and by extension you starve off these fibroids and they shrink, they don't continue to grow. Yeah, those are the main non-surgical interventions. There is also something, it's not available in the country, like in Western Europe and America. It's called ultrasound-guided laser therapy, where high intensity waves from ultrasound machines are directed to the fibroids, and this dissolves the fibroids. But this one is not available in Kenya, but in Western Europe and the Americas, it's available. Yeah, those are the options.
Okay, Dr. Thank you so much for that.
Yeah.
And I know that you've mentioned um, the options so that women can be able to understand. And I just wanted to make this note. I'm seeing that you mentioned about carbohydrates, and you said that eating a lot of carbohydrates could be, one of the things that, one of the reasons why women end up having fibroids. So this is in relation to high blood sugar levels and how high blood sugar levels.
Yeah. High fat, you get a lot of sugar, then it's stored in the body as fat, which is broken down into estrogen hormone, which stimulates the fibroids. So it's an indirect cause.
Okay. I don't know if you guys can hear me well because I feel like I'm being told my sound is not that good. Can you hear me clearly?
We can hear you, but there are moments where there is like a noise from the background.
Okay, so if it sumbuas, maybe I will leave and then come back. But as I leave to come back so that I can have good sound, maybe I can just first read the first question here that was there was a first question here. I'm seeing you had already answered. Someone wanted to know if fibroids actually affect sexual intimacy. And you've already answered the fact that fibroids does cause painful sex. I hope the person who posted this question has gotten their answer. And if not, you can be able to also just post because Daktari has indicated here that when the fibroids are big, they cause pressure in the lower abdomen and vagina, and this can lead to pain during sex. So that was the first question. And there was another question here that was quite interesting. And it says, I would love to ask if it's true that having your first child reduces chances of getting fibroids. If a woman has a child, does that reduce their chances of getting fibroids?
Yeah, what we've noted is that those who delay having their first child up to their late 30s and 40s then tend to have more fibroids. But so that the implication is those who have earlier, they have a reduced chance, but it does not prevent it completely. But the chances are a little less than those who get their first children at a later date. Hello?
I think Fatma has gone off so she can come back because
Yeah,
of the
I was
sound.
audible. Was I
Yeah.
audible?
Oh, she's back. Yes, you are
But
audible.
I actually wanted to know if my sound was better. I just left so that I can improve the sound.
It's a better now.
Yes, but I could hear you through the laptop. Thank you. So now there's another question. And the other question was asked regarding maybe we can mute Florence. Yeah, that's okay. Yeah, there's a very, very important question here that was asked, and it says if you have fibroids, but then you don't want to have kids in the near future, like in the next few years, how can you prevent them from growing? So this is someone who has fibroids, but as you had mentioned, also delayed um, uh, pregnancy for a woman actually exposes them to a lot more estrogen. So how can they ensure that they prevent the fibroids from growing? They already have them. They're not planning to have kids anytime soon, maybe because they're young. How can they be assisted?
Yeah, one option if they are very big is to use the injections I mentioned, but they can only be used for a period of 6 months because beyond that, the side effects are a lot. For those who can afford, the best is to afford. That is a good option. But mostly that one of the injection or the use of the progesterone containing pills, like something we call Primolute. or Dufaston, which is in the market. One can use that to slow down the growth of the fibroids.
Okay, so it's more or less like buying time.
Yes, because it slows down their growth so that eventually when one decides to get children, they are not too.
Okay. And another question, Daktari, because I had a question here from someone, and I'm seeing someone else has even asked, do fibroids grow in the uterus or anywhere else in the body? Someone had reached out to Wellnesske because they have breast fibroids. So I really wanted for you to educate us on breast fibroids so that we can learn what they are and, from just your point of view, what do you think women can do to prevent?
Yeah, uterine fibroids grow within the uterus, and it can extend into the ovaries or the surrounding structure. Breast, they are called adenomas. They are fibrous tissue like some small balls that grow in the breast, and they are common, especially in girls in their teen and in their early 20s. But if we find them in older women, then they become very suspicious and risky. So the ones of breast are not called fibroids; they are called adenomas or fibroadenomas. They are called fibroadenomas, but not fibroids. So you can have different growths in different parts of the body. So that's what the ones in the breast are called fibroadenomas. They are non-cancerous growths in the breast tissue. So when you feel you press, you will feel a lump of whatever size. It doesn't grow as fast, doesn't cause pain. It's only that discomfort when you press on it or on the breast, and you feel there's something here. Yeah.
And I'm assuming, Daktari, that this is also related to hormones, right? This is also related to your hormones.
There's a link to estrogens. Yeah.
Okay. Okay. So a woman who has high estrogen levels could possibly also have the adenomas, the fibrocystic breasts.
Possible, yes.
Okay, sawa. So the difference between that and a fibroid is basically just the location.
The location, yeah.
Okay, but the behavior is the same.
Yeah, the ones of the breast don't grow that fast. And of course, if they're in the breast, then they'll cause different signs. For example, just that feeling that there's something in the breast. Some women will complain of pain in the breast. Yeah, because as it grows, it is stretching the surrounding tissue or muscle.
Okay, sawa. Thank you so much for that, Daktari. And I'm seeing another question. Someone has said, my sister had fibroids 15 years ago and they were removed, but they grew again, but this time bigger, and she's in a lot of pain. What can she do?
Yeah, like I said initially, fibroids grow from uterine muscle. So long as the uterus is there, you can remove and others grow. You see, as you are removing what you can see, but there is that one that is starting as like a small cell, and it will grow, and with time, it can grow to a size similar or even bigger than the original one. So the only time you can have a guarantee that they will not grow is if one has the uterus removed. And of course, a uterus is a very important organ. We only remove it as a last resort.
Yeah.
Yes. So like this lady who is already having very big fibroids and is in pain, it's time she gets checked. If she has had the desired number of children, one would advise probably now is the time for her to have a hysterectomy if she's not intending to get children anymore, because even if you remove the fibroid and they come again, it's not good to keep subjecting one person to many surgeries. Yeah, but all those factors can be assessed individually when she goes for a review.
Okay, so and maybe I can add the fact that also because you've also advised us with regards to lifestyle, and also Dr. Mariam has advised us with regards to lifestyle. I think after a woman has had treatment for fibroids, it's important when they go back home that they also have a switch in terms of their lifestyle, in terms of their diet, and also checking their hormones, since they already know that this is an issue that is related to high estrogen levels. Which brings me to another very important question. So because now more and more women are learning about their hormones and hormone health. So how does a woman get the chance to check her hormones? What is the procedure, Dr.? Do they come to you? Do you send them to a specialist? And what would you be looking for in that particular situation?
Yeah, estrogen is the female hormone. It's produced in the ovaries. Most times, unless there are some certain signs or symptoms, it is produced in normal amounts, and it's cyclical. It depends on which. After one has their menses, it will increase. Then after ovulation, it goes low. During pregnancy, it's high. So the only time one should be checked for hormone levels, one is if there are issues with fertility. Probably there could be an imbalance in their hormones. Two, if they are having abnormal vaginal bleeding, that's outside the normal menstrual bleeding, then they should be checked. Sometimes those with obesity, they should be checked. But if one has normal periods, they get regular cycles, normal flow, not heavy, they have no other signs, most likely their hormones actually are normal. And again, for the tests to be useful, because they fluctuate in the cycle, at the beginning when one is bleeding, the levels will be different. Mid-cycle during ovulation, they'll be different. And towards the end of that month, they'll be different. So for especially the reproductive hormone levels, they'll only be useful if one has a condition that makes one suspicious that probably one could be having excess or an imbalance of these hormones. Because the body is very well designed to regulate the amounts, but of course, once in a while, things don't go as they were created to be.
Yeah.
Yeah. Okay.
I get you, Dr. And also, in terms of now the test, for instance, this is someone who has felt like maybe they have abnormal bleeding, or they see that this is something that they need to get checked. So, are you the right person for them to come to? Because there are many women, I'm sure, right now who would like to have their hormones checked because maybe they do suspect something. So, would you be the right person to
Yeah, they should be. Yeah, yes, they should see their gynecologist, because there are many. Say somebody is bleeding, they need to be checked. It could be that an infection amongst many other things, so that the doctor can prescribe the appropriate hormone to test. Because the hormones are so many, and they are fairly expensive. So one needs a guidance so that whatever you do, the interpretation can be useful in trying to solve the problem the particular lady is presenting with.
Okay, I get you. Sawa, Daktari. So ladies, for those of you, I know this question came up a lot. That's why I asked it.
Yeah,
Most women are like, we want to get our hormones checked. Where do we go? How do we even begin? And what are we looking for? So I'm sure we'll even have another conversation regarding that, a deeper conversation, so that they can have even proper guidance, right?
Okay.
Yes, and then there's another question here. Someone is asking, are cysts a health risk? And why do they cause abdominal pain? And are they associated with fibroids? Could you kindly touch on this? So I'm sure this person is talking about ovarian cysts.
Yeah. Ovarian cysts arise from the ovary. The ovaries are two organs, one on each side of the uterus, and this is what produces the eggs. And also it's what produces the hormones, the female hormones, estrogen, progesterone, among others. sometimes during the process of ovulation, there's accumulation of fluid on the ovaries, and it forms a balloon-like swelling with fluid. That's what we call a cyst.
Okay.
Yeah, most times if the cyst is small, it's less than 4 centimeters in size, tends to go away on its own even without treatment. If it causes pain, all it needs are just simple painkillers. However, if the cyst is large, it's more than 6 centimeters, then this one needs to be probably one either uses medication or it's removed surgically if we feel it's a threat. They are not related with fibroids per se. One can have cysts without having fibroids and vice versa. Most of the cysts will not cause abdominal pain, but sometimes if you get the mid-cycle around the time of ovulation, that one can cause a bit of pain. Yeah.
Okay, sawa. Thank you so much for that explanation, and thank you for asking that question, because I'm sure there's some women who would love to ask something like this, and you've explained it really well. I know, at the topic on ovarian cysts is also a big one because of PCOS, polycystic ovary syndrome. And Dr. I can say that also there are many women who reach out to me and they have issues where they have not seen their menstrual cycle for a number of months. And I always tell them that's not normal. Some of them have actually gotten to a place where they're saying, no, it's okay. I don't have them for 3-4 months and then I have them. And I'm like, no, that's not okay.
Those are the ones now should have their hormones checked, among other things.
Yes, completely. I completely understand you. And there's another question here. Someone is saying, I have a big fibroid measuring 12 centimeters. And lately, I feel like taking a lot of sugar. Most of the time, I find myself taking tropical sweets and particle sweets like daily. What is the problem and what can I do over that? I'm guessing now she's just having this big surge and she just needs sugar constantly.
Yeah, 12 centimeters, that's quite big. Probably if she bleeds a lot, or just by that sheer size, there is a chance that she's anemic, so the body has less blood circulating, less oxygen, and with that, with body fatigue. So the only way of energizing is taking something sugary. So what she needs to do actually is to, if she can, visit the nearest hospital where they can have a gynaecologist assess and advise her on what she needs to do. I suspect there's a chance she could be anemic, and because of the body fatigue, so there's that urge of taking sugary things to try and boost the body energy.
Yeah. Okay.
Yes.
And I think we will leave Dr.'s number here for the women who are here, so that you can be able to reach out to him. And Dr. is able to, she's saying thank you for answering that question for her. We'll leave Dr.'s number here, both the doctors, so that, they can be able to reach out to you and schedule an appointment, because I really feel like when it comes to women's health issues, there's a need for that guidance, someone who can be able to just walk you through and explain to you what's really going on. Because when you don't know, that's when you have that fear, and then you have this, you actually start creating answers for yourself. Maybe I'm this, maybe I'm that, when really, like what you've just explained, maybe she just, because maybe she's becoming anemic and because of energy levels, and now she needs sugar. The body itself is saying, this is what I really need. And I feel like that's a very, very valuable point that you've shared here. So even for the questions that had come in, I feel like most people were giving also their thoughts. Someone had mentioned that some people confuse the adenomas with breast cancer. So maybe, Dr. you can tell us when someone has the difference, when someone has breast cancer and when someone has the adenomas.
Like I said, adenomas are these small swellings of the breast that can be growing. Most times they are not cancerous, but if you have a breast lump that is very painful, it is increasing very fast in size, it's growing fast, it is suspicious. The best way of finding, even for us,
Mm.
because breast cancer is the commonest cancer in the country
Okay.
overall. If there is any swelling of the breast, we recommend as a tissue, a sample has to be taken, and we take it to the lab. That is the only way of ensuring it's not cancer.
Mm.
Yeah, it would be a bit risky for anybody to assume that it's not unless it is tested in the lab. Because
Okay.
because of how common breast cancer is, that's the best advice. Have it checked. Sometimes we just put a needle, rotate it, and take some cells and take
Mm.
it to the lab and have it checked.
Oh.
With about 5,000. Long term, it's very that is not too much.
Mm.
Given if it's found it's cancer that early, some simple surgery can be done and it is cured completely. Then
Okay.
one risking, then later one is found to be having cancer of the breast. So it has to be checked always.
Okay. And I'm assuming that for somebody to have that done, they need to come to you as a gynecologist, right? So if a woman has that worry, because someone has messaged me on the side and said they actually have an adenoma, and
Yeah.
that then it is advisable for them now to go to a gynecologist, right?
Yes, precisely.
Okay, sawa sawa. So, ladies, we are going to leave the numbers to both doctors so that you can be able to reach out to them and they can be able to assist you with these, the conditions, and also, walking you through so that you can make the better informed decisions. And as Dr. said, the earlier you know something, the better. So you don't have to have fear. Don't have fear over what could happen. It's best for you to know. And the moment you find out that this is what it is, you can actually be able to deal with it and be well and be better, which is the whole point of this conversation. And I think that, when it comes to everyone just sharing their thoughts and their comments, um, it's important to also note that there are some people who are just some people who were saying they were a bit shy to ask their questions direct. So that's why some of the questions are from the book and some are from here, which is still okay. And I'm seeing this comment here. I didn't know not having periods over a long time was a problem, but luckily after having my son, my cycle became regular. I don't know if that contributed to my cycle changing. Could Daktari touch on that? So I think before she was pregnant, she did not have normal as a normal cycle, but then after she had her son, now her cycle is regular. Did
Yeah,
that contribute to her being
yeah,
better?
yeah, that happens. During pregnancy with all the hormonal changes, sometimes it tends to balance out what's in the body. And there are many women who have a lot of pain before delivery. After that, you find the pain goes. So that is actually true. The pregnancy contributes to regularizing the cycles. And mostly, if those who have a lot of pain during their periods, it tends to disappear. But not always, but most.
Okay.
Yeah.
Okay, so then it actually, yeah. So I hope your question was answered. It actually did contribute, and pregnancy actually balances out your hormones. So that's a very, very important point. You're welcome. She's saying thank you. You're welcome. So thank you for even posting your questions and for asking and making this conversation as interactive. And I just wanted to also ask anyone else if they have any other questions, because we want to make sure that you guys also don't spend too much time. We want to make sure that you get the most out of the conversation. And I know everybody has had a very long day, I'm sure, work, wherever, so that we can be able to learn the most within this short amount of time. So I wanted to also add that when it comes to just maintaining your health, it's also important for you to take care of your wellness. And I'm sure Daktari will agree with me and Dr. Mariam will agree with me. These things actually play a part in making sure that you are well. So even after you've gone to see the doctor, you've talked to them, they have given you, your treatment options, you've started your treatment journey, they are taking care of you. Even as you go back home, it's of course important that you now do a lifestyle switch, meaning you have to find out what it is that goes into your body in terms of your diet, your nutrition, in terms of physical activity. Maintaining a healthy weight is also important. If you need to get some checkups that were advised, then you need to do them. As a people, we need to get into that culture of doing that. And I know that not many people actually are in that culture have adopted that culture of, let me go and get a checkup just so I can make sure that I'm okay. So I wanted to just make sure that I advise anyone out there that don't just leave it all to both the doctors to just heal you and then you go back home and not make any changes. It works in that way, such that you have treatment options, but then you're also playing a role in taking care of yourself every single day. And I'm seeing there's another comment, not sure if this was covered earlier. If not, could Daktari touch on risks associated with health of the baby if you do get pregnant while having fibroids? So if a woman is pregnant with fibroids, does that affect the baby in any way?
Not quite. It's only if the fibroids are in the uterine cavity, there's a slight risk of a miscarriage. But until so
Sorry. Okay, Pole, we could not hear you.
I was saying, for the baby who grows until term, actually it does not affect the baby. Will continue to grow normally. The only risk that is there is a slight risk of miscarriage, especially if the fibroids are within the uterine cavity. So the babies are able to grow without any problem.
So then it means once she gets pregnant, it is important for her to know the location of the fibroids, right? Because then that would at least let her know if it is going to be a risky kind of pregnancy, so to speak.
That's true.
Okay, sawa. And Daktari, the fact that even you've touched on this particular point, I want to ask whether you feel like in terms of the treatment options that you've shared with us, there are women here who really just want to hear from you the non-surgical treatment options that you've shared with us. Do you feel like these are treatment options that women should try, or do you feel like it is something they should approach but cautiously? And I ask this question because I interact with a lot of women every day, and they all have questions with regards to some of the treatment options that are out there. So it's almost like they are doubting, because the risk factors are too many. So if you could advise us, do you feel like these are treatment options that you would advocate for, and you feel like they would be able to help women out there who have this issue? Daktari, are you there? I think maybe you're muted. Maybe it's his network. I think Daktari. Okay, we cannot hear him. Maybe it's his network, but as Daktari fixes his network or his sound, I'll now pass it to Dr. Mariam so that she can be able to, I think it's his network because I'm seeing he left. Maybe it's his network. I'll pass it to Dr. Mariam also to give us some word of advice, because she has shared with us the different ways that we can be able to care for mental health if a woman has had a fibroids diagnosis. And some women might not admit it openly, but we've all gathered here just so that we can be able to learn. As I've shared, I'm someone who had fibroids. So we really want to understand what advice do you have for us so that we can be able to learn ways to take care of ourselves, so that we can be able to care for our mental health, you know, in the best way possible. Over to you, Dr. I hope you are able to hear me.
Thank you, Fatima, and thank you everybody for being here. Just to finish or to summarize, like I had said earlier, it is important for us to take care of our mental health, as it is important for every person that has any medical condition. And in this case, somebody with fibroids, like we said earlier, there are so many things that can crop up because of the fibroids, and there are things that will also be made worse because of that being in that condition and the way the person responds to them. So all in all, it's important to do like I had said, and this is not, of course, conclusive, but first of all, things that are positive to the person. Of course, having a positive mind is important, because what we think is what we become. If we decide to think about something and focus on it, it is, if it is positive, it is in a way helping us in making choices that are positive. If we focus on the negative also, then that's it. We will get into the negative side very quickly. In fact, it's easier to get to the negative than even positive. So, of course, taking care of your health, just like, even to add what the doctor has said, maintaining physical fitness is very important. And when we say physical fitness, it doesn't mean going to the gym and spending the whole day in the gym, but just that aspect of where you are active physically. And because of this being active positively, it affects you positively in a way that it helps to enhance your brain, it enhances your memory, and even the feel-good hormones are released in your body. So when you exercise, it releases the feel-good hormones, which also counters now the stress in a way. And then because you know that you have this, we also say social, it's important to have social networks. When you interact with positive people socially, then it also helps. It helps to avoid isolation, because that is where depression comes in. And when we see that somebody is isolating themselves, we should also be able to help, because most of the time when somebody is in a condition or has a condition that affects them, it's easier for them to need help but not say directly. So they might show it by maybe isolation, with the hope that somebody might notice and at least respond and help. But then usually what people do is they feel like this person has isolated themselves, then they don't need help, and we avoid such people. So even the person who is not infected or who doesn't have the fibroids, or the family, the friends should also be ready to support this person psychologically, physically, and emotionally. We also say that the diet is very important when it comes to even mental health. So we are what we eat. So having a diet that has the balance, the prerequisite, whatever nutrients that are required in the body is very important. And of course, if you have this diet that will help your body, and then also physically find that if you are in that way, then it will also help you to feel better, because your body image also is affected in a way or one way or another. So when you maintain such a lifestyle, it will help you to be able to at least handle this issue and maintain this. And let's not underestimate having help or receiving help and seeing the doctor, maintaining a relationship with the doctor so that you have checkups and you are in a way monitoring your situation throughout. So, of course, it's important also to maintain a work-life balance if somebody is working, so that you maintain a work-life balance to be able to in a position that will help you. So we know that when you overtire yourself, then of course it will help. So it is a vicious cycle that we need to look into, and generally introducing self-care routine. To add on what you said, that it also requires to make some lifestyle changes. So before you make these lifestyle changes, it is important for you to, it starts in the mind, of course. And when it starts in the mind, you can do it bit by bit. And that is how we will be able to at least get used to that system. For example, if it means you want to stop sugar, you should not wake up today and decide that you are not taking sugar at all. It's important to start. If you are taking 2 teaspoons or tablespoons, then you start by reducing it from 2 to 1.5 to 1, until you get to a point where you can do with very less and even without. So you take everything in with systematically. You should not just have that drastic change immediately, because it might get you off balance. Yeah. So I think that in a nutshell is for today, and I want to thank everybody so much for having really taken their time, apart from being tired all day, and just listening. Thank you so much. We appreciate you all and wish you good health. May you all be healthy, inshallah. Thank you. Back to you,
Actually, thank you so much. You mentioned something very important about slowly reducing the sugar and getting to a place where you don't use it at all. So Dr. Mariam is my mom, for those of you who do not know. And that is something that as a family, we've all tried to do, is just when it comes to sugar, especially sugar in tea, or sugar in something, that's something that we've worked on completely, and it was a step-by-step process. But anyways, yeah, so many people are saying thank you so much for the session. You see, I know Dr. Mokomba had left us kidogo, and then now he has come back. But we wanted to make sure that we don't take too much time. And also I want to now give Daktari this opportunity also for him to share with us a word of advice, so that women can be able to have something to live with here with regards to their reproductive health. Daktari, I hope your sound is okay now.
Yeah, thank you. Sorry, I got an emergency call, but I'm back. So I would commend Fatma for this session. It's a very enlightening, and if we have more of this, then we'll be able to take care of the reproductive health needs of our women. You realize reproductive health needs were in the back burner, and they still are, and most of them are stigmatized. You can imagine, people don't expect you to go and say, I'm having excessive bleeding. They would want people to hide, yet these are important indicators of health, whether it's things to do with pregnancy, things to do with general reproductive health. I think these are very enlightening sessions, and the more we have, the better. So thanks everybody for joining in. I would also say, take care of yourself, have checks if you have something that is not normal, and share with somebody. It can really help, and you will be able to get the support whenever you need it. Thank you so much.
Thank you so much. And remember, ladies, you can be able to reach out to Dr. Mariam from Duara Psychology if you know anyone struggling with their mental health issues, and also because she focuses on family therapy. So that is child psychology, and also couples therapy, marriage counseling, and also one-on-one counseling. So make sure that you check the contacts in the segment there so that you can get her information and you can reach out to her, have a session. We're having so many people, dealing with a lot, but they're not necessarily sharing with someone, as Daktari had said. And also for Dr. Alfred Mukomba, you find him at Kenyatta National Hospital. And the contacts are also here. You can be able to just reach out to Daktari if you had any queries, any issues. You want a Daktari who will walk with you on that journey so that he can be able to guide you in terms of treatment, in terms of ways you can take care of yourself. And we want to hear success stories of women who have taken care of their health. They're happier, they're feeling better. And I also want to remind you that if you're looking for information and also natural solutions so that you can be able to improve your health and wellness, make sure that you also follow Wellnesske. We always post information. If you found this session to be helpful, then make sure that you follow Wellnesske on Instagram, on YouTube. We have our channel. You can subscribe on Twitter. We've put the links there so that you can just click to make it very easy for you. Remember, you can be able to try our nutrition plan. We have a nutrition plan so that you can be able to start your healthy lifestyle and journey. We also have our fitness plan. You can start your exercise from home. As you heard from both doctors, fitness actually plays a role. Your weight plays a role in balancing your hormones. And don't forget, every single time you wake up in the morning, be grateful to God that you're alive and you're well. And one way that you can show gratitude is by just taking charge of your health, because no one is going to do it for you. A doctor can help you and assist you, but then you have to take charge and say, this is my health. I'm doing whatever I can to make sure that I maintain it. So I really want to say thank you to both of you, both doctors. I asked them to be here and to help the lady, and you managed to do it. Thank you so much. I know you're very busy. Thank you to all of you who are here. Florence, Barbara, Edith, Jemima, Miriam, Mishi, Nancy, Paulina, Priscilla, Shoaib, Suleiman, all of you are here and listening. And some of you, if I've not mentioned anyone's name, thank you so much for even joining us, for sharing your thoughts, your questions. So I'll just leave it at that. We wanted to finish at exactly 8:30, and it's 8:28. So you guys have 2 minutes to add any comments and make sure that you follow Wellnesske so that we can let you know the next time we have another session. Does anyone have anything else? You can unmute if you want to share something. Thank you so much for the session. Yay, thank you. You're welcome. Looking forward to other informative sessions. You're welcome. Thank you so much, Mishi, for even making the time. Thank you, Barbara. You guys, I want you guys to be healthy and to be well, so feel free to just send in your questions, so that the next time we have another session, you can be able to get help. Oh, I love you for free. Oh, Florence, I love you more. Thank you so much, my dear. Thank you so much. And